Hi, Dr. Murdock. How are you?
How are you?
I'm great, thanks. So we're back here by popular demand after your COVID vaccine MythBusters series. So we're here today to talk about the newly available Johnson & Johnson vaccine. So hoping you can shed a little bit of light on that. We'll go through a couple of questions and answers, and we'll try to keep things short. So maybe to start things off, you can explain the difference between the mRNA vaccines that are available, that being Pfizer and Moderna, and this now viral vector vaccine that Johnson & Johnson is offering. So what is the difference?
So, you always have to have a way, when you have a vaccine, you have to have a way to get it into the body, because the idea is to activate the immune system so that when you do see the virus, the real virus, then your body is ready to respond. So there's always got to be what we call a vector, and that's how the immunogen gets into the body. So with Moderna and Pfizer, it's just a little piece of messenger RNA. With the Johnson & Johnson vaccine, it's a piece of DNA, but it's within what we call a viral host. And I know that sounds scary. Oh my gosh, we're injecting a virus, but it's an inactivated virus, so it cannot cause an infection. It's what we call an adenovirus, which is a type of virus that causes a common cold. So it's not going to cause any kind of infection. It's just a way to get that piece of DNA into the body. And then what happens is that piece of DNA carries the message to make the spike protein, just like the mRNA also carried the message to make the spike protein. So really, once you're getting that vector into the body, they're working the same way. So then what's going to happen is your body's going to make that spike protein. It's going to be recognized as foreign, and it's going to activate your immune system. And what's really cool about the Johnson & Johnson vaccine is that it's single dose, which is so much easier logistically. This is going to really allow so many people in the population to be very quickly vaccinated instead of having to schedule one and then another one. So this is going to be really game changing, I think.
Oh, that's amazing to hear. So, look forward to that being rolled out a little bit more quickly for that reason. Well, thank you for kind of explaining the difference there. It's fascinating how that works. And correct me if I'm wrong too, but the kind of viral vector vaccines are what have been around a little bit more in the past too, correct? Like
there's been some in development, but not terribly widely used.
Okay.
Yeah. Got
it. Okay, so in terms of the clinical trials that took place and the information that's out there, it seems like the Johnson & Johnson vaccine is maybe slightly less effective than the other vaccines. Is there a reason for that?
Well, we think that, it's kind of like comparing apples to oranges. So when the studies were done with Pfizer and Moderna, it was a more limited population. There was only one type of the virus circulating at the time. Now we have different viral subtypes that are circulating. I mean, that's what viruses do. They mutate and they change. And so part of it may be that, it was done in more countries and there was more people that were exposed to different types of the virus. And what's most important is that there was 100% prevention of death from COVID and severe disease.
Right.
And so that's really what we're looking for. And keep in mind that, the Johnson & Johnson vaccine is still more effective than the influenza vaccine that we take every year. And the idea here is that the more people get protected, aren't spreading disease, we can achieve this immunity across the world. And so, whatever vaccine you can get it.
Great. And maybe lastly, you could just close by touching on some of the guidance from ACOG and ASRM and just related to recommendations, vaccine recommendations for women who are pregnant or might be planning on becoming pregnant or trying to conceive?
So the American College of OBGYN has added the Johnson & Johnson vaccine to their practice statement, where women who are pregnant should be offered the vaccine. So it's right in the same category as the Moderna or Pfizer. So one type is not better than the other for pregnancy. Again, this is not a live virus that's being used. It's an inactive virus. It's an adenovirus, which we're all exposed to. So the safety in pregnancy should be equivalent. The other thing that I think is really cool is that the Johnson & Johnson vaccine is being tested in pregnant women. So there's a real ongoing study, pregnant women and infants. So it's really cool that we should get some real data from a study about the Johnson & Johnson vaccine. I talked about a few days ago, the data that we do have about Moderna and Pfizer. That's not a study, that's just observational, but it is good data to have. But it would be nice to have, data from a real, prospective study. And so to me, the fact that they're doing a study in pregnant women and infants means that everybody feels that it's pretty safe.
Well, that's amazing news, and we'll look forward to more information as it comes available, and maybe that's when we'll reconvene again and chat through it. But thank you again, Dr. Murdock, and as always, appreciate the information, and we'll talk soon.
Yep. Bye-bye.
Right.
Get your vaccine, wash your hands, wear your mask.
Stay safe.
Yep.